I'm Dr. Marina, and what I'm going to tell you today may hit close to home if you're a man over 60. I'm not saying this to scare you, but because I've seen with my own eyes how something as small as the prostate can completely change a man's life. I've had patients who spend years getting up 3, 4, or even 5 times every night just to urinate. Imagine what that means. Nights without rest, days full of fatigue, irritability, lack of energy, and the saddest part is that many accept it in silence, convinced that it's normal with age, as if resignation were the only way out. But I want to tell you something clearly. It doesn't have to be this way. Your prostate health isn't set in stone. There are simple habits, things you eat, what you drink, how much you move, or even how you handle stress that directly influence the size and health of this small gland. And here's the good news. Just as certain habits cause damage, there are also small changes that can help you improve significantly. I've seen men of 70 and even 80 years old sleep well, urinate without discomfort, and enjoy their lives with energy. The difference? They decided to take care of themselves in time. That's why I invite you to stay with me. Because this video isn't about complicated theories or impossible treatments. It's about you, about what you do every day without realizing it, and how those repeated gestures over time affect your prostate. Before talking about those habits, I want to explain in simple terms what exactly the prostate is and why it causes so many problems in older men. The prostate is a tiny gland, about the size of a walnut. It's located just below the bladder and surrounds the urethra, which is the channel through which urine exits. Its main function is to produce part of the seminal fluid that protects and transports sperm. So far, so good. The problem starts with age. From 50 onwards, and in some cases even earlier, the prostate begins to grow. This growth is called benign prostatic hyperplasia. It's not cancer, but it can become a big problem if not controlled. Why? Because when the prostate increases in size, it compresses the urethra. The channel becomes narrower and urinating becomes difficult. The stream is weaker, often you feel like you haven't emptied completely. And most commonly, you get up several times during the night. In some men, the bladder can no longer empty completely. This opens the door to urinary infections, stone formation, or even complete urinary retention. A painful and dangerous medical emergency. I've had patients who came to the emergency room after hours of not being able to urinate a single drop. And the most concerning thing is that this process is slow and silent, like a drop that falls every day until suddenly the glass overflows. You might think, well, this happens to all men with age. And let me tell you something, not necessarily. I've seen 70-year-old men with a perfectly healthy prostate, and others at 55 suffering from severe symptoms. The difference isn't just genetics, but lifestyle. What you eat, what you drink, whether you move or not, if you go to the doctor in time or hold back, all of this has an influence. And that's the great news. If habits affect it, habits can also help. That's why today I'm going to show you 10 common habits that enlarge your prostate without you noticing. You don't need to change your whole life at once. It's enough to identify one. That one where, while listening to me, you think, oh, I do that. What and start there. I know it sounds contradictory. Many men tell me, Dr. Marina, if I drink more water, I spend the whole night going to the bathroom. And I understand them. Nobody wants to interrupt their sleep. But drinking little water doesn't solve the problem, it makes it worse. When you don't drink enough liquid, urine becomes concentrated. It becomes more acidic, more irritating to the bladder. And right below the bladder, what's there? The prostate. This concentrated urine inflames, irritates, and increases urgency to urinate. Furthermore, if you take diuretic medications for blood pressure, your body is already losing fluid. If you don't replenish it, your urinary system suffers twice as much. What do I recommend? It's not about drinking liters at once. Do it in small sips throughout the day. Observe the color of your urine. If it's clear or light yellow, you're good. If it's dark, your body is asking for water. With something as simple as better hydration, your prostate and bladder will already be receiving enormous relief. Now that you know how important hydration is, I want to tell you about other equally common habits that, although they seem harmless, may be slowly harming your prostate more than you can imagine. Have you ever wondered how many hours of the day you spend sitting? Between watching television, reading, using your cell phone, or simply resting, many older men spend between 7 and 9 hours a day without moving from their chair. And although it may seem like an unimportant detail, I assure you it's very harmful to your prostate. Why? Because sitting for so long puts constant pressure on the pelvic area. This pressure reduces blood flow to the prostate, decreases oxygenation, and promotes inflammation over time. Additionally, the pelvic floor muscles, those that help empty the bladder, weaken. The result, you urinate with more difficulty, urine is retained, and this accumulation further irritates the prostate. I remember Richard, a 69-year-old patient. He was retired and spent almost the entire day in his armchair watching the news. When he came to my office, he complained of burning when urinating and getting up 5 times a night. I asked him to make a very small change. Get up every 30 or 40 minutes, walk 2 minutes around the house, go up and down a couple of steps. 3 weeks later, he told me, surprised, "Doctor, now I get up only twice at night and I feel more energetic." See, you don't need to go to the gym. Just get up and move a little. Every gesture counts. I know that for many, coffee is a sacred ritual, almost untouchable. But if you already have prostate issues, this point is key. Caffeine acts as a diuretic. It makes you urinate more and also stimulates the bladder muscles, causing them to contract, even without being full. This creates urgency and the annoying sensation of, "I have to go right now." It can also contract the neck of the bladder, making complete emptying difficult. This leaves residual urine, increases pressure, and promotes inflammation. I'm not saying eliminate coffee completely, but do review the quantity. 3 or 4 cups a day, plus sodas, plus black tea, that's too much. Try something simple. Replace the second cup of coffee with a caffeine-free infusion. Chamomile, mint, anise, or horsetail are gentle options that relax the bladder. James, 72 years old, told me he couldn't function without his 4 coffees. But after a month of reducing them to 2 and adding herbal teas, he confessed, "Doctor, now I sleep better and don't feel so much urgency." Tasty food is a blessing, I know, but when we abuse spicy food, salt, and ultra-processed foods, our body resents it. What are ultra-processed foods? Deli meats, instant soups, potato chips, frozen meals, factory-made cookies. They're all loaded with sodium, bad fats, and additives that alter the male hormonal balance. The result? More inflammation and greater risk of prostate growth. Regarding spicy food, there's no problem if you enjoy a good meal from time to time. But if every meal involves hot peppers, black pepper, and salted red meat, you're creating a constant inflammatory environment. My advice: cook more at home, use vegetables, fish, fruits, nuts. It's not about eating boringly, but eating with awareness. Your prostate will thank you. Louis, 66 years old, ate tacos with hot sauce every day. After reducing that habit and adding more salads, he told me, "Doctor, I thought it was going to be hard, but I even feel lighter, and I don't have as much nighttime urgency." This habit seems harmless, but it's more common than you think. Many men say, "I'm busy, I'll go later," or "I'm too lazy to get up now." The problem is that when you hold your urine, the bladder overloads, and as it stretches, it puts pressure on the prostate just below. Over time, this causes inflammation, burning, and difficulty emptying completely. And that retained urine becomes a perfect breeding ground for bacteria, increasing the risk of infections. The recommendation is simple. Listen to your body. If you feel the urge, go to the bathroom. Don't postpone it. It may seem like a small detail, but in the long run, it's a powerful way to protect your prostate. So far, we've seen 5 habits that seem harmless, but have a big impact. Too little water, many hours sitting, excess caffeine, abuse of spicy and ultra-processed foods, and holding urine. Did you recognize yourself in any? Don't feel bad. Most men do them without knowing. But now that you know, you have the power to start changing. And that first step, believe me, already makes a big difference. You now know the first 5 habits that harm your prostate. Now let's talk about 5 others that, although they often go unnoticed, can be even more dangerous, because they don't just affect the prostate, but your general health. When we think about the damages of cigarettes, the first things that come to mind are the lungs or the heart. But few know that the prostate also suffers. Tobacco reduces blood flow throughout the body, including the pelvic area. Less oxygen, fewer nutrients, and the prostate becomes more vulnerable to inflammation. Additionally, smoking decreases levels of natural antioxidants. Without them, your body can't properly repair damaged tissues. There are studies that show a direct relationship between tobacco and increased risk of prostate cancer. And not just in those who smoke, but also in those who breathe secondhand smoke. I've seen men who quit smoking after 60 and within weeks started to sleep better, urinate more easily, and have more energy. So it's never too late to quit. And if you don't smoke, protect yourself from others' smoke. This is one of the most common mistakes. Many men only go to the doctor when they can't take it anymore, when the pain is unbearable, or when family forces them to. The problem is that prostate enlargement advances silently. Initially, there's no pain, no fever, not even burning. But when symptoms appear, sometimes there are already complications, recurrent infections, urine retention, or even kidney damage. A simple checkup once a year can make all the difference. With a digital rectal exam, an ultrasound, or a PSA test, we can detect problems before they give severe symptoms. I know many are uncomfortable talking about this, but believe me, it's much easier and less painful to check in time than to face complications later. It's not about demonizing meat. A good cut once in a while isn't a problem. The risk appears when you consume it every day, especially processed hot dogs, bacon, sausage. These foods are loaded with saturated fats and additives that promote inflammation and alter the male hormonal balance. Result: the prostate grows faster and urinary discomfort appears. Additionally, the digestion of these meats is slow, produces gas and constipation. All of this generates more pressure in the pelvic area, which aggravates the symptoms. What do I recommend? You don't have to eliminate it completely. Just reduce it to twice a week and prefer lean meat, baked or grilled. The rest of the days, choose fish, chicken, eggs, legumes, and vegetables. Albert, 67 years old, was a fan of daily barbecue. After reducing his red meat consumption, he confessed, "Doctor, I feel lighter, urinate with less discomfort, and even my digestion improved." I know this topic can be uncomfortable, but not talking about it would be irresponsible. Abdominal fat isn't just an aesthetic issue, it's constant inflammation. Men with a waist larger than 40 inches have more risk of prostate enlargement, erectile dysfunction, and nighttime awakenings due to urinary problems. Why? Because excess fat alters hormones. It lowers testosterone and raises estrogen, which favors prostate growth. Additionally, the abdominal fat itself puts pressure on the bladder and worsens the situation. But here's the hope. You don't need to lose 40 pounds at once. By losing just 5 to 10 pounds, you can already notice improvements in your symptoms. Walk every day, reduce refined flours and sodas, control portions. It's not about suffering, but choosing better. This may be the most ignored habit, but believe me, it's one of the most powerful. Stress isn't just mental. Your body resents it. When you live worried or distressed, you produce more cortisol, the stress hormone. Over time, that generates inflammation, hormonal imbalances, and muscle contractions in the pelvis. The result? More pressure on the prostate, more discomfort when urinating, and worse quality of life. I've seen patients improve a lot just by learning to manage stress, sleep better, breathe deeply, walk in the open air, talk to someone they trust. They didn't need medicines, just to slow down. Philip, 70 years old, worked all his life in a family business full of worries. He confessed to me that he had never had time to relax. He started doing deep breathing for 10 minutes a day and walking after dinner. In 2 months, he already felt like another man. He slept better, and his urinary symptoms decreased. So far, you've seen the 10 most harmful habits for your prostate: drinking too little water, spending hours sitting, overusing coffee, eating too much spicy and ultra-processed food, holding urine, smoking or being exposed to smoke, not getting medical checkups, eating excess red meat and processed meats, having abdominal overweight, living with chronic stress. None of them seems serious if you look at it in isolation. But together, repeated day after day, year after year, they take their toll. The good news is that you have the power to change. You don't need to transform your whole life at once. Just choose one habit to start with. And little by little, you'll see the difference. So far, we've talked about the 10 habits that can harm your prostate. And maybe while listening to me, you thought, "Doctor, I do several of those." Don't worry. It's not about blaming you, but opening your eyes. Because the most important thing is that it's never too late to start taking care of yourself. To make it clearer, I want to share 3 real stories of my patients. 3 men, 3 different ages, 3 ways of life. All of them managed to improve their prostate health with simple changes, nothing complicated. The story of Ernest, 74 years old. Ernest came to my office exhausted. He had a downcast look, spoke in a low voice, and told me with embarrassment, "Doctor, I get up to go to the bathroom up to 6 times every night. I don't rest. I'm in a bad mood, and my wife can't stand me anymore." He had lived like this for years, convinced it was normal for his age. But when we reviewed his daily routine, it all made sense. He drank very little water, had 2 strong coffees in the afternoon, spent hours sitting watching television, ate deli meats every day, and hardly walked. We didn't need drugs. What we needed was order. I proposed something simple. Drink water in small sips during the day, but stop drinking liquids after 6 in the evening. Replace afternoon coffee with chamomile tea. Get up every 30 minutes to move a little. Go for a 15-minute walk after lunch. Change deli meats for fruits, oatmeal, or nuts. 3 weeks later, he returned to my office with a different face. He smiled and told me, "Doctor, I've had 5 nights where I only get up once. I sleep like I haven't slept in years." His wife, who accompanied him, added with emotion, "He's laughing again. He has desires again. That's worth more to me than any pill." Small changes, big result. The story of Manuel, 68 years old. Manuel was a retired driver. He had never had a prostate check because he said, "If it doesn't hurt, there's no problem." One day he attended a talk I gave at a senior center. Afterwards, he timidly approached and confessed, "Doctor, I think something's wrong with me, but I'm afraid they'll find something bad." He had no pain, but he did have symptoms: weak stream, feeling of not emptying completely, nighttime urgency. We did a digital rectal exam, ultrasound, and PSA analysis. The result, mild benign prostatic hyperplasia. Nothing serious, caught in time. I told him something very clear. This can get worse or better, and it depends on you. We started with simple changes. Reduce the red meat he ate every day. Include fish, lentils, and more vegetables. Do gentle stretches in the morning. Go to la digno, bed half an hour earlier. But the most important thing wasn't the diet, it was the heart. Manuel confessed to me that since he retired, he felt useless. He kept everything in. He didn't talk about his anxieties. That emotional weight was making him sick, too. Just by expressing it, his face changed. 2 months later, he returned to my office calmer, happier, more present. He told me, "Doctor, I didn't know that taking care of the prostate was also taking care of the head and soul." And he was absolutely right. The lesson from these 3 stories, Ernest, Manuel, and Julian, show us the same thing, that it's never too late to improve, that you don't need to make drastic changes, just one at a time is enough, that the prostate always responds at any age if you take care of it consistently. Perhaps today you're like Ernest, exhausted and frustrated, or like Manuel, afraid, but wanting to improve. Or maybe you're doing well, like Julian, and want to stay that way as an example for those who come after. Whatever your case, the important thing is that you've already taken the first step by getting informed. That, believe me, is worth a lot. Now that you know the 10 habits that harm your prostate and have heard the stories of Ernest, Manuel, and Julian, I want to close this topic with a very clear message. The prostate may be small, but the impact it has on your life is enormous. Your rest, your energy, your mood, your intimacy, everything can be affected when this gland isn't well, but everything can also improve when you take care of it. It's never too late to start. Sometimes my patients tell me with resignation, Doctor, I'm already 70. Why should I change? And I always answer the same. Because your body always responds. Always. Age doesn't matter. What matters is giving it what it needs. I've seen 80-year-old men recover sleep, strength, and even a smile just by making simple adjustments. You don't have to change everything at once. Start with one, the one that resonates most with you. Maybe it's drinking more water. Maybe moving every half hour. Maybe quitting that pending cigarette. Maybe getting your first medical checkup. The important thing is that you start. Your prostate is not your enemy. I want you to change the way you see your prostate. Many men feel it as a burden, a hindrance that only brings problems. But it's not like that. The prostate works silently throughout your life. It produces part of the seminal fluid, helps fertility, is part of your male identity. The problem isn't it, but how we treat it, with neglect, with bad habits, with silences. When you decide to take care of it, you discover it's not your enemy. It's your ally, the 4 pillars of prostate care. To make it easy to remember, I always summarize prostate care in 4 pillars. Conscious hydration, water in sips, clear urine, no holding. Daily movement, it doesn't matter if it's walking, dancing, or climbing stairs. The important thing is to activate circulation. Real food, fewer ultra-processed foods, more fruits, vegetables, fish, and legumes. Food is medicine. Regular checkups, don't wait until it hurts. Checking in time is your best life insurance. If you work on these 4 points, you're already doing more than most. The weight of the mind. I can't finish without talking about something that seems vital to me. The connection between the mind and the prostate. Stress, anguish, sustained sadness. All of that inflames, alters hormones, worsens symptoms. When on the other hand, laughing, resting, talking about what you feel, hugging, walking in the open air, listening to music, all of that is also medicine. Remember Manuel. He improved not only because he changed what he ate, but because he learned to talk about what he felt. The prostate also listens to your emotions. You take the first step today. After listening to me, you might wonder, Doctor, where do I start? The answer is simple. Choose a habit and write it down somewhere. On a paper, on your cell phone, in the comments of this video. Putting it in writing makes it real. It can be, today I start drinking more water, or today I walk 15 minutes, or today I call to request my checkup. That's already a commitment to yourself, and I assure you that your body will thank you for it. Share to take care of others. Maybe this message isn't just for you. Perhaps you have a brother, a friend, a father, a colleague who needs to hear it. Sometimes men stay silent out of embarrassment, but a conversation can change a life. Share it. Talking about the prostate isn't a taboo. It's an act of responsibility and self-love. My final message for you. I want you to keep this idea engraved. First, age doesn't condemn you to suffer, and your prostate can be healthy at any age. And the last, you have the power to take care of it with simple decisions. You don't need expensive medications or preventive surgeries. Often it's enough to go back to basics: water, movement, real food, rest, and medical checkups. Remember Julian's metaphor. Your body is like a garden. If you water it, aerate it, and take care of it, it blooms. If you neglect it, it withers. The prostate is part of that garden. Take care of it, and it will take care of you. I am Dr. Marina, and I hope this message gives you the clarity, hope, and motivation to start today. It's not about aging with resignation. It's about aging with dignity, health, and joy. Thank you for being here, for listening to me, and for opening your mind to this important topic. See you in the next video.